This was a young male presented to us with severe abdominal pain, and the pain was radiating to the back. On ultrasound, everything was fine, but the pancreas was swollen and edematous. There was also some peripancreatic fluid and a mild pelvic ascites also noted. The next, we got X-ray of this patient. On the X-ray, usually the three signs are positive. The most important sign is the colon cutoff sign. The second is the sentinel lobe sign, and the third one is the pleural effusion. But on this X-ray, the colon cutoff sign is shown very clearly. So next we got the CT abdomen of the patient with the IV and oral contrast. On the CT scan, liver, spleen, and rest of the viscera were normal, but the pancreas was edematous and swollen. There was also peripancreatic fluid noted as shown in the CT scan, and the mild abdominopelvic ascites was also noted on the CT abdomen. So, what is the criteria to diagnose? We have usually three parameters. The number one is the clinical. Clinically, we have to look for the severe pain, vomiting, nausea, and the second is the labs. In the labs, we have to calculate the serum lipase and the amylase. Usually, the serum amylase lipase is raised more than three times than the normal values. And the third important thing is the imaging. On imaging, we can do ultrasound, CT scan, and also sometimes the MRI. So we have already discussed. The next thing is the what are the complications. There are two type of main complications. The number one, either there would be peripancreatic fluid collection in less than 4 weeks, or after the 4 weeks, this can develop into the pseudocyst formation. The second is the pancreatic necrosis. If the pancreatic necrosis will develop in the first 4 weeks, it will lead to the acute necrotic collection, and after the 4 weeks, this can lead to the walled off necrotic fluid. The less common complications can be the pseudoaneurysm formation, or the portal venous thrombosis, or the splenic venous thrombosis. And the next step is the management of the patient. The most important thing is the fluid resuscitation, and in within the 24 hours, it is very important to resuscitate the fluids. And the second thing is the prophylactical use of antibiotics. And the third thing is the feeding of the patient. The feeding is usually enteral feeding is preferred, strongly suggested as compared to the parenteral feeding, especially in the severe cases of pancreatitis. The other aspects are the if the pancreatitis due to the gallstone, we can remove through the ERCP, and if the pseudoaneurysm formation or the some pseudocyst formation, we can also help from the intervention radiologist for the catheter placement and the drainage of the pseudocyst formations and fluids. Thanks for your patience. Hopefully, you have enjoyed. Thank you.